economics and marketing of laser refractive cataract surgery. Now, can I have a pointer? Now, laser-assisted refractive cataract surgery, I think, is something that has come of age. And if you are looking, there are various systems, and we have had the opportunity of working on both the LensX and the Catalyst system. Now, when you are in the process of acquiring a laser cataract surgery system, you have obviously several thoughts in your mind, and one of the most important thoughts in your mind is, does it work? Does it benefit the patient? And is it going to be economically viable to me in the practice? So how does one, after getting convinced that it works, how does one go towards success and not go towards failure? Now, before installation itself, once you have decided that you are going to buy a system, you have to identify and prepare a core team. That means a team that is going to be the femto team or the femto cataract team, and for them the buzzword should be femto. So therefore, whether you ask the company people or you do it yourself, you have to create a team awareness. Best is to have all your staff sit down one day and give them like a public lecture as to what exactly a femtocataract does and how it is going to help. And after doing that, you should be able to identify the team and spread information among all the staff, starting from the front office reception, the call center, to the counselor, to the PRO, to the optometrist, OT staff, doctors, everybody. There should be a buzz that there is something new that is happening, which is the ultimate in cataract surgery today. The second thing that you have to do is that you need to price it right. Often in Indian circumstances, one wants to underprice or undercut the procedure, and that devalues the procedure and makes it a Me Too procedure, and would obviously diminish the returns. However, if you overprice the procedure and it is more expensive than what a normal person can afford, then it becomes too restrictive. So you have to price it right. We in our center have priced it 50,000 rupees extra than whatever the person pays for that category of intraocular lens by MICS procedure. Now, in the team training post-installation, you have to go through an in-service. The OT staff needs to go through the in-service, as also the optometrist or the technician who is putting in the data needs to undergo this process. The counselors need to be selected, and you have to identify the core team as the femtocataract experts. Now, the new blade-free laser technology, there are several ways that people have communicated. One of the communication is new blade-free laser technology, and the other communication is robotic cataract surgery, wherein you are looking at computer-assisted, laser-assisted robotic surgery. And you have to do this both in the clinic and outside the clinic, and you have to differentiate it from the standard cataract surgery that you have. Now, what we do is that at the reception, when a patient registers, every patient gets an information brochure right at the time of the registration. So because it's a new procedure, you need everybody to know as to what it is. The waiting lounge, patient sees femtocataract banners proclaiming that it is superior. What are the reasons of superiority of a femto laser cataract? The optometrist in the workup for a cataract patient to the cataract patient would talk about femto laser. The associate doctor would offer femtocataract as a default surgery. That means that any patient walking into our center would by default have advised femto laser assisted cataract surgery. So that is a default setting that you have to make, and the senior consultant would confirm and would clinch the final thing that a patient goes for. The counselor books the patient and then follows it up. Now this is the brochure that we give to the patient at the time of registration, the 2-4 pages to it. Now the next thing is that the waiting lounge, when a patient is doing nothing, just waiting or getting the eyes dilated, at that time you need to have something wherein you have this particular thing. It could be even your lifts could carry this, or you could have something like this, which could be a self-illuminated board. and that is what is required. Now when you go to the clinical team, the important thing that I've mentioned is optometrist talks about it, the associate doctor talks about it, senior consultant talks about it, and counselor talks about it and books it. But make as a default, I at least believe that this is the best surgery that is available, and we are often misjudging the capacity of a patient to pay for a surgery. It is our own I would say, or our own feeling that this person, if I tell him that you have to pay ₹1,00,000, he will run away. But please do not underestimate. People are willing to pay for their health care and they want to get the best. Now then you need to have patient awareness outside the clinic or the center, and you need to create the brand awareness of a superior technology that is available, and you should be at a premium center. It is difficult that if you have branded yourself as a low-cost center and then you are trying to promote a premium surgery, it kind of it's a dichotomy, and it's a thing which could be a problem. Now you need to involve everybody in campaigns to spread the message around. You should incentivize people who are performing higher numbers at odd levels and integrate all the peripheral and referring centers to improve patient conversions. For example, we have 2 femtocataracts in Delhi and we have 12 centers. So it should not be that the other 12 centers should not be allowed to do that. They should also be allowed to do that, and they should refer it to the common machine. It is there, so you should encourage everybody to do that. Now, in-clinic market and staff motivation tool, for example, this is something that we put on the label of the coat or the uniform of a person. No blade, no compromise, ask us how. So that is staff badges, and you need to keep a monthly score of the femtos, and everybody should be talking about it. Now, we did a campaign which was 100 femtocataracts in 1 month, and we integrated all the centers and encouraged all the staff members and made an incentive scheme for them who came forward, and we were able to get to that number almost. So we treat femtocataract patients exclusively. That's the next thing, that when the patient comes in or post-operatively, we have separate colors discharge cards. So a discharge card of a femtocataract would be different from a normal cataract surgery discharge card, so that you know that this is a premium patient and he needs to be treated a little differently. For example, if you're traveling on first class, there is a separate line. You go into a lounge, you have better, the moment you sit down, you get a towel, you get a drink, and etc., etc. So you need to give some exclusivity to them, and faster and efficient throughput for those patients. If possible in your center, ambience environment and the stay should be extra comfortable, because these are new age patients who want premium services because they are willing to pay for premium services and they want a wow factor. So the key points which have helped patient understand the value of femtocataract better than regular phaco is, it's a blade-free procedure. It makes the surgery more precise, more accurate, and today there are a lot of papers showing that the surgery has safety elements and the outcomes are better, and better results are there, which gives rise to accuracy as regards the effective lens position, emetropia, and treating coexisting astigmatism. Also, it is more gentle on the eye, and possibly the recovery is faster. What we think is the inhibition for non-conversion. Today, I would say from my own patients, about 30 to 40% are femtocataract patients, despite and because, I would say despite, or is it because of our premium prices? Often there are patients who will come, you put the best lens, if you tell them that this lens is 1 lakh rupees, they will go for that, because for them often price is a thing. So at times a premium also attracts patients to you, and everyone wants a more advanced surgical technique which offers superior results. But one thing that is important is this I believe. If you do not believe in the technology, you are going to be a disaster. Only if you are convinced with the technology, only if you have seen live surgeries, only if you have seen and gone and seen that how it works, and you believe in it, then only your team will believe in it, and then only you will succeed. So finally, what I'll say is that there are the 4 P's which define femtosecond blade-free cataract surgery. One is precision of a premium surgery. Second is power of the laser to connect with the patient, but you need to be patient and it will pay for itself. This is just to show you how we went. When we started in April 12, our numbers were like 10. But if you see these graphs, see where we have gone, and we are almost doing 80 to 90 plus surgeries in our good season, and you can see the same trend in December also, and November, etc. That's what's happening. Finally, the last word that I wish to say is, as more and more units are being put up in India and across the world, and more people are talking that this is a procedure which is giving them excellent results in their hands, I believe that this is the technology of tomorrow. You should not be the first one to adapt to a technology, but never be the last one, because then you become a Me Too product. So I think the time is ripe when you or anybody who is a high cataract surgeon should look at getting into this technology. Thank you very much for your kind attention.